The topic today is prevention and treatment of exercise-induced muscle and joint injuries. My father said to me, son, I have a lot of good advice to give to you, not because I've been so smart, it's just that I've been so stupid. So one of my credentials to present to you today is not only that I've been lifting weights for over 54 years, I'm a world champion powerlifter and a competitive bodybuilder. I placed third in the Mr. Universe contest and took Mr. Universe Street Physique. A lot of my own injuries, my own mistakes, my own stupidity. You know, it's the type of thing, the ways I'm going to tell you about to prevent injuries and to deal with injuries, particularly the prevention. A lot of us don't follow the prevention methods. Why? Because you're not building big muscles, you're not building stronger muscles, and quite honestly, it involves using very light weights that many of us elite athletes would be embarrassed to be seen in a gym lifting those light weights. That's the honest truth of it. We're talking 10 pounds, 15 pounds, 5 pounds to prevent these injuries. As a result, we keep repeating those injuries over and over again, and I put myself in that. You reach a point, though, after you've had enough injuries, it's sort of like a dentist. With myself, I'm almost 69 years old. I've lost 4 or 5 teeth that I don't have. I wasn't flossing, brushing, rinsing with peroxide or Listerine. I wasn't really taking good care of it. And I knew what I needed to do to prevent those tooth loss, but I just was in a rush, had other priorities, didn't do it. As a result, I've had root canals, teeth pulled, implants, you name it. And it was mostly probably preventable. And now, at the ripe old age of almost 69, I floss every night. I rinse out with peroxide and water at night. I use something else to keep my mouth moist. And then I wake up, I rinse with Listerine, brush. I do it now, but I, like many people, have learned the hard way. Now the same applies to these injuries. I've had so many injuries over the course, particularly my powerlifting and bodybuilding career, mostly related to my own negligence and stupidity, as it's true for many, many people. Now there are those who escape without getting injured, either because of their genes or because they were sensible. The main cause of injury? Overtraining. Overtraining. When you work out, you're not building muscle. That doesn't build the muscle. People have the wrong idea. It stimulates muscle growth. But unless you leave time for recovery and then muscle growth, another process, you're going to damage yourself. There's the erroneous idea in powerlifting and bodybuilding and in all strength athletes that more is better. Not true. More is not better. I'm here to tell you that. Not only in terms of developing muscle size and strength, but also once you go into an overtraining state, you will actually lose strength and you're at much higher risk of injury. So I'm giving you what I've read about, what I've experienced, and I want to help prevent your injuries and have you have a way to treat them when you have them. I right now, by the way, have rotator cuff injuries and a bicep tendon injury. I've been on bench pressing for close to 6 months now. Military presses. I'm so embarrassed by it with my right shoulder that I don't even like to do it in the gym. I'll do it in my home, take some dumbbells and just kind of pump some blood in there. Particularly if you're an elite athlete, you will be. I knew a man who used to do 10 reps with 500 pounds at a particular gym. As he got older, he refused to go back to that gym. Why? He couldn't do 10 reps with 500 pounds. So he was embarrassed to be around those guys who knew him as a big guy. So a lot of ego enters into this whole factor. And people don't take the proper precautions on the warm-up, particularly rotator cuff injuries, and I've had my share of them. There are 4 strap-like muscles that constitute the rotator cuff that stabilize the shoulders. Infraspinatus, the supraspinatus, the teres minor, and the subscapularis. And we're going to go over where those muscles are and exercises to prevent damaging ourselves. Because if you get a rotator cuff injury, it's going to slow down your progress in all areas. In a military press, in a bench press, you're going to have a problem with upper body work.